Welcome to the Rare Sense Podcast. This is Chris Irwin. Today I'm speaking with Dr. Kevin Weiss. Kevin is a board-certified physician with extensive training and experience in primary care, holistic, and energy medicine. Early in his career, he served patients with complex chronic diseases who often had causal issues beyond the technology or scope of standard medical diagnostics to detect. As a result, he developed his current practice of systematic healing to serve this need. Kevin uses advanced intuitive energy testing, or AIET, to diagnose people, and then uses modalities such as vibrant physiology, biomagnetism, and energy healing to treat them. And he does most of this without being physically co-located with his patients. I realize that remote energy work is something that many people may not believe is possible. I used to feel the same way. But after nearly a year of working with Kevin, my skepticism has waned considerably. I've found his treatments to be effective. I've also learned that I don't necessarily need to understand something for it to work. If nothing else, his techniques are super interesting, and I encourage you to listen to this episode with an open mind. Note that anything we discuss is for educational and informational purposes only, not medical or mental health advice. It's not intended to diagnose, treat, heal, cure, or prevent any illness or condition. Although Kevin is a doctor of osteopathic medicine, he is not acting in that capacity here. He serves as a healing minister, not a licensed medical or mental health professional. Systematic Healing owns all copyrights to the materials presented here, unless otherwise noted. Lastly, remember that Rare Sense content is not medical advice, nor does it represent the official position or opinions of any other organization or person. If you require diagnosis or treatment for a mental or physical issue or illness, please seek it from a licensed professional. Now, without further ado, here's Kevin Weiss. Okay, Kevin, good to see you.
Good to see you, Chris.
Dr. Kevin Weiss here. So where do we want to start here? I mean, I always ask, kind of give me a little background on you. I think the most interesting thing about you, first of all, I should say that I came across you because of Freddie Kimmel, who is somebody who, if people out there have not listened to Freddie's podcast, it's great, especially if you're a chronic illness sufferer. That's what he does, basically. He's sort of like a biohacking chronic illness dude, and not a biohacking guy like in the what's the guy's name? Is it Ben Greenfield? Is that the guy's name? There's that guy
sure.
who's a hardcore biohacker. He's been on Rogan and stuff like that. He's not into biohacking. Freddie is more into it for like.
Right. There's a difference between doing it for optimizing versus you're trying to fix something that's chronically messed up. Yeah.
So I came across Freddie's stuff years ago, I think when he was first starting, and reached out to him. And I think he was so much in his infancy that he like responded, was like, yeah, DM me and give me a call and everything.
I think he's
so I've listened to his stuff because it's great. And he's turned me on to some alternative therapies and things that have been really helpful. But anyway, I heard you on his podcast and I thought it was so interesting. And it was so different than anything I'd ever heard or done. And it was also something that things come to you sometimes at the right time.
Sure.
And it was something that had I heard it, I've mentioned this to you before, if I'd heard it 5 years ago, I would have been like, fuck off, right? Like I wouldn't have bought into it at all. But at the time, and I trust Freddie, I was like, okay, sure. So I reached out to you and we've been working together now for, gosh, how long? 6 months? More than that?
Approximately, yeah. I'm going to show my phone off. Yeah, 6 to 8 months ballpark, something like that, yeah.
So anyway, let everybody know kind of what you do, and your background and trying to become a doctor and then being a doctor, but doing different stuff, right?
Yeah. Things kind of evolve. So, I just kind of knew I was going to be a doctor since I was a kid. And I was always pretty intuitive since I was a kid. I told my parents when I was about 6 or 7, I said, I'm going to become a doctor and marry an artist. Sure enough, I did. And so I kind of knew that this is just kind of my path, although it took twists and turns that I wasn't expecting. I thought I was going to go to medical school and become a surgeon. When the reality of the wards hit me and I got on the surgical rounds, I realized pretty quickly, I mean, as cool as it was, it wasn't quite for me. And so I kind of got more into the primary care aspects, and I started getting interested in holistic aspects of medicine. And just the thing that just kept flabbergasting me throughout medical school, but even more so even in residency and kind of starting out my career as a primary care doctor and then kind of transitioning into holistic medicine, was how much chronic illness that the medical science and system just does not understand. It just absolutely flabbergasted me. So the first year in medical school, at least the way it was for me, the first year was all anatomy and physiology. This is what normal anatomy and physiology does. This is how it works, yada, yada, yada. I loved it. I got good grades. I enjoyed it. I ate it up. It made a ton of sense to me. The second year was all what disease looks like under a microscope and what the diagnostic criteria for the disease is and what the drug or surgery of choice is to fix it. And I just couldn't wrap my head around it. My grades, I didn't do terribly, but I started getting more mediocre grades, which wasn't so typical for me. And it just kept going like this. And no matter what I did with my study habits, I couldn't seem to wrap my head around this. And about, halfway, 3/4 through the year, I kind of took my head up for air and realized, oh my God, this field knows almost nothing about health.
I love
it. Oh, shit, I'm too far into debt. I can't stop now. They know a lot about disease, and I don't say it to disparage the system. It's, it has its uses, so I would say particularly when it comes to trauma surgery, emergency medicine, critical care medicine, allopathic paradigm saves lives day in and day out, all the time, no questions asked, 100%, totally useful and valuable in those arenas. But when it comes to chronic issues, it's like we don't have, it's like, if you really look in the literature, you get into integrative and functional medicine, you'll learn differently. But as far as things are taught in medical school and as things are understood in standard medical practice, even the simplest thing like hypertension, right? 90% of people that have hypertension, we call it essential hypertension, which sounds like some very fancy highfalutin thing. But really what it boils down to is we don't freaking know why this person has high blood pressure, but we're gonna throw drugs at them. And that's better than doing nothing for certain, because the outcomes are clear that people get less strokes and heart attacks and cardiovascular disease and so on and so forth when the blood pressure is controlled, no doubt. But it just flabbergasted me to realize, oh my God, this is like one of the most common chronic issues that walks around on the planet, and yet for 90% of the people, we have no idea why it's happening. Really? And so, as I got deeper and deeper into my practice and residency, I guess the question of why just kept eating at me. Why is this person who's in front of me sick? How at some point, for people who aren't born with genetic diseases, for somebody with an autoimmune disease or Lyme disease or long COVID or something like that, at some point, this person in front of me was what we would call normal. And at some inflection point, they became abnormal. So how is it that they went from being normal to being abnormal? And how do we get them back again? And this question of why just kept eating at me and eating at me and eating at me. And so...
Can I stop you there for a second, though? So why does conventional medicine, because this is something that I came to the same conclusion through my own, as a non-doctor, somebody who has no medical training whatsoever, as a patient, as a sufferer of chronic illness, came to the same conclusion of, it doesn't seem like modern medicine knows anything about how to solve chronic illness. And when I say chronic illness, I don't necessarily mean things, that term is used in a lot of ways.
True.
Sometimes it means things like diabetes, and there's things that it's decent at treating, but these sort of mystery chronic ailments, like you're talking about, sort of Lyme disease,
chronic fatigue,
if they're even the different things,
right.
Fibromyalgia, right? Those things.
Sure.
And I came to the same conclusion where it's like, they just don't seem to have any answers. But before you get into kind of the why people either are getting these things or have these things and some of the solutions, why is the medical establishment no good at treating that? Is it the lens they look through? Do they not care? Is it too complicated? I mean, this is an opinion question, obviously. You can't
Right, because
say for
we can't,
sure.
right, of
And
course.
it's not like there's
Yeah.
some evil overlord out there that's like, I will, right? I'm going to sell these people. I mean, maybe there's a few of those, but
Well, the pharmaceutical industry, without naming names, is the top spender of lobbying Congress from
sure,
year to year.
sure. And I agree
And
with that. Yeah,
yeah, and I'm not saying there's not a place for it. Obviously, there is. But this is so much of what the medical curriculum comes down to is what drug or surgery are you going to end up applying to this person that's in front of you. And so to think that pharma does not have some say on the medical curriculum is,
sure.
yeah,
But isn't there, I mean, like, we're supposed to believe that doctors, scientists, whatever, are constantly sort of like trying to find the answers and objectively looking at things and hypothesizing. And
from my experience with this, my sense of it is that I think people see somebody in a white coat and they tend to pedestalize them, so to speak. I don't think that's an actual word, but you understand what I'm saying, that they get put up on a pedestal. And I very quickly came to find out in medical school. I mean, now certainly these people are generally, more intelligent than your average bear. But in terms of moral compass, and pretty much everything else you can think of, they're people just like everyone else. And I think a lot of it honestly comes down to like exhaustion. You go through your 4 years of college, you go through your 4 years of medical school, you go through your residency, you're hundreds of thousands of dollars in debt, you've got your credentialing and your training to do what you want to do. And then to come in with these ideas that there are these huge gaping holes in your training, right?
mm-hmm.
I don't think for most people, the human ego is not very accepting of these kinds of thoughts.
Yeah.
Right. You spent all that time, money, and energy, just to be told that, oh, if you really want to fix people, you got to go learn some whole, after you've put all this time and energy, you got to go do all this. Yeah. And so doctors are just as susceptible to Pavlov's hypothesis as everybody else. You know what I mean? So people get things beaten into their heads. And like the number of doctors that are like that are really digging through the literature to really try to solve things is, I mean, from the doctors that I've worked with, which is probably a fair sample size, it's very low. I think for most people, with the exception of a couple, some specialties require a little bit more reading and such. But a lot of doctors, after they get done with residency, they're kind of done. They do their minimal to stay up on, some of the stuff that you absolutely have to stay up with. But people have put in their money, they put in their time, their sweat, their blood, their tears, and they're kind of just ready to collect a paycheck and move on. And I get it.
Sure.
I can see why people would think that way and behave that way. I think a lot of that's unconscious. I don't think people sit there and journal to themselves, okay, I've now spent my $200,000 and I put in this many hours and now I'm just done with this shit. I don't want to study anymore. I don't want to dig anymore. I'm done. I'm going to show up to work, collect my paycheck, and move on. I don't think that's what's happening, but I think, people, it's, you get battered in medical training.
Sure.
And it's easier, when someone's got a mystery disease to say, and this is the thing that shocked me in residency, to see how many people with, especially like I didn't quite realize how much of Lyme was Lyme when I was a resident. I only really figured that out afterwards. But how many people with physical symptoms, neuropathic symptoms, pain, and like legitimate neurological abnormalities on their physical exam. And I would watch some of my mentors and attendings say, oh, it's all in their heads. They just need to see a psychiatrist. And I'm like, do you not see what's happening in their physical exam? Hello.
Yeah.
Like, yeah, sure. There's some element of anxiety or depression there. Sure. Or some other psychiatric issue. Yeah, sure. No doubt. But that doesn't explain physical symptoms.
But it's also a situation, right, where that's a separation problem where they're saying, oh, this is a mental thing, which is totally separate from the physical thing. And I just don't think that's true. There's a,
I think it's a tricky thing because for some people it is true, and there are plenty of people out there where they're either anxious or depressed, and they got no pain, they got no brain fog, they don't get headaches, they don't get gastrointestinal disturbances, they're not waking up in the middle of the night, they're not getting panic attacks, yada 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 yada, and they get on some Lexapro and they're doing the river dance. Good for them. So I would put them in, that's largely a neurochemistry imbalance. There's other natural ways to do it too. The drugs, I look at it as a tool. I'm not for or against drugs. They're a tool, right?
Yep.
And you've tested, from energetically AIET standpoint, you've tested, well for a couple of pharma products, throughout our work together. And I said, as long as you're doing it under the supervision of somebody who you got a medical relationship, I have no problem with that, and you've done well with it. So I'm not against the pharma. There are times when people certainly they do have a psychiatric problem. The problem that I see with the medical system is that they completely miss when the two are interrelated. And,
Right.
and the crazy thing to me is that at this point is that really if you just did a basic review of systems.
Yeah.
Right, like going through the neurologic system, going through the musculoskeletal system. I mean, because it doesn't take me long. Like I sometimes, in my more medical practice, I'll catch people who have had chronic Lyme or other tick-borne infections. And it's, they start telling me they're chronically fatigued. It takes me about 45 seconds to figure it out now. Do you have brain fog? Do you get migrating aches and pains? Do you get headaches? Like, do you have numbness and tingling that comes in? Gee, I wonder what you've got. That's a hard one.
Yeah. Well, so a couple things on that. I agree. Yeah, I agree with you. Obviously, people can have something that's essentially just a mental problem or just a physical problem. However, in my opinion, those things are still interconnected, right? Like your mind and body, you can't like just separate them into two things. So the same way you could like just sprain your ankle, and it's like, is that a mental problem? Not really, right?
But it can mess with your head if you're an athlete and you need that ankle to work for you.
Exactly.
Yep.
Right. And you're still like the pain you still experience is a mental construct essentially.
Sure.
Right.
Sure.
All right. So let's go back to sort of you're in residency and you said gaping holes, right? So what are the holes? What were the things that was not computing for you?
Yeah, and for me, I think, and I recognize a lot of it is Lyme. We didn't really have long COVID, back when I was a resident. That came later. But I was in a dual family medicine in what's called neuromusculoskeletal medicine residency. So we were getting trained in osteopathic manipulative medicine. So for those who don't know, I'm licensed as an osteopathic doctor. So I was trained, not just in medical school, but additional residency training to do manipulations with the body. So for people who don't know what this is, it's almost like a chiropractor and a doctor together in the same person. Mm-hmm. My colleagues probably wouldn't like me saying that because there's a lot of subtle distinctions, but for a layperson that doesn't understand, I think it's a good scaffold to start understanding what that is. So we would have clinic regularly where we would do, manipulative treatments for people that had a lot of musculoskeletal complaints. And a good portion of these people, they would kind of improve, but their stuff would keep coming back, and we had a bunch of frequent flyers. And for a lot of them, their pain was way out of proportion to what I would find on their physical exam or what I would see on their imaging. And they got, they would have all these other psych issues and headaches and fatigue and, all the other stuff that goes along with chronic Lyme. And I'll admit at that time, I just kind of sectioned it off in my head and was just kind of treating their musculoskeletal stuff. Cause I'll just be honest, I didn't have bandwidth for it at that point. So, but I was looking at their musculoskeletal stuff and just thinking to myself, like, why, like this should be fixing according to this model that I'm using. So I'm missing something. I don't know what it is, but I know I'm missing something because the person in front of me is not getting better.
Yep.
And yeah. So, and then I got out of residency. I did some primary care for about a year, and then I got a job as a holistic doctor on Park Avenue in Manhattan. And the first thing I did before I started working there was to go to ILADS, which is basically like the Society for Lyme Literate Physicians.
Oh, right. Okay.
And that kind of started piecing it together to me. And it was just so wild to see so many people, so there's the typical, knock down, drag out, the symptoms that we've described before, the people with a lot of the kind of typical stuff, the brain fog, the headaches, the fatigue, the neurological symptoms of tingling and burning pains and this kind of stuff. But the wild thing that I saw too is that I kind of became convinced that I think that this organism is kind of getting to be ubiquitous in the country, because I would also find some people where they would have, some sort of like a low grade autoimmune condition.
Yep.
Or they would have like an arthritis that was bothering them. And when I would do the physical exam on some of these people, their musculoskeletal complaints didn't really add up with what they were having physically. And at this point, I had enough presence of mind to do the AIET testing, and then I would figure out, I bet they've got a little bit of Lyme or some other form of tick-borne infections. And then what I would do is give them, generally some herbals, because the chronic stuff, I generally tend to not prefer drugs. So I would give them herbals, and sure enough, a lot of their aches and pains or other, seemingly unrelated symptoms would start improving, if not resolving.
Okay. And then what? Because what you do now is clearly a step beyond that too.
Yeah.
Right?
Yeah.
Right?
Yeah.
Actually,
Everything.
Before we get to that, let me just ask you, again, I think about Lyme disease, and it's clearly a thing, right? Like, it's not bullshit.
No, it's definitely not bullshit.
How it came to be, I don't know. There's stuff out there about it being a bioweapon, and, who knows, right? But who cares at this point? But it's clearly a thing. And it's another one where I just think, for the longest time, it seemed to me the medical establishment sort of acknowledged it was a thing, but it was just kind of like threw up their hands. It's like, I don't know. We don't know what to do. And we're not really going to try either. Like, we're going to give you antibiotics because it's a bacteria. It comes from a tick. But if that doesn't work, we don't know. And that just seems, again, like just gross negligence from my
right. And that's the thing. And that's the thing is that, doctors get trained, and when they go through their training, and they've got their box. Mm-hmm. And very often, if somebody's symptoms don't fit the box that person got trained with, then very quickly, I wouldn't say automatically, I won't go so far as to say that, but very quickly, doctors will write them off to the psychiatric department.
Right.
This happens all the time.
Yep.
All the time. I'll never forget in residency, I had a woman that had like chronic pain, and I'm like I'm doing a neurologic exam, and she's got weakness. And I'm like trying to convince my attending to get an MRI. And he's like, she's got fibromyalgia. Don't bother. And I'm like, but she's got focal weakness on her exam. Like, sure, maybe she's got fibromyalgia, but that doesn't, oh my God. But so this is what, and this is not a stupid person. Yeah. This is a really, really smart person. So it's, this kind of indoctrination, I don't think anybody would want to admit that it happened to them. But just from my experience, people go through this training and they get indoctrinated.
Yeah. And well, fibromyalgia blows me away too, because it's another one where, unlike Lyme disease, where at least they can say, well, we think it comes from this bacteria, at least in part, right? But a lot
of fibromyalgia is undiagnosed Lyme.
Right. Could be.
Not all of it.
But the point is, like, fibromyalgia isn't even, in my estimation, is not even a diagnosis. It's just it's a name to symptoms.
Yes, it's what I would call a wastebasket diagnosis. That's the label that goes to what
that's I've never heard that, but that's a great way to say it. It's like, okay, you have you have these symptoms, and we're just going to give it a name. And that doesn't help at all. It's because it's like, well, what causes it? Well, we don't know. Well, how do you treat it? Well, we don't know. Well, it's like, what's the point of this diagnosis?
The language is the etiology is complex, and the treatment is multidisciplinary.
Okay. Got it. Yeah. We don't know. Right.
Which means we don't have a damn clue.
All right. So keep going on the journey here, because what we're eventually going to get to here is the stuff you and I have done, which is like remote energy work and things again that I would have been like, no way, this is not.
10 years ago, I probably would have said the same thing. So
right. Yeah.
So I started seeing a lot of Lyme in New York City, because that people would be out in the woods and they would get tick bites.
Yep.
So it was all over the place, and it still is, and it's severely under-recognized, and you're to echo your thoughts that it is a thing, it is a big thing, it is a huge problem. It is an enormous problem, and it's like if you can't even recognize it,
Sort of like you've mentioned to me before, right? Like most of people in Africa are walking around with some form of malaria, right? They might have like just.
Well, I don't know about most of them, but the medical literature would, at least for what's been tested for,
Yeah.
is that somewhere on to the tune of 60 to 70 million. I think this research is maybe about 10 years old.
That's
60
most.
to 70 million. Yeah, it's a lot. I think it's probably a billion. How many people are in Africa?
I have no idea. I don't know.
How many people in Africa? 1.2 billion. So that's
Okay.
a lot of them. It's a good chunk. Yeah. So a good chunk of this population walks around with a level of the malaria parasite in their system. And it won't be high enough of a level of malaria to trip the standard testing, but it will be a high enough level to give somebody some pretty rocking symptoms, or not always rocking, but it's some level of symptomatology and subsequent dysfunction. And so there was some research done where they would take these people and they would do like higher levels tests that were basically, university level stuff that you're not going to get in your standard lab. And sure enough, they would find that these people were carrying this parasite. And a very similar thing is happening with Lyme disease, and I'll say with many other organisms as well. And the thing that really opened my eyes, and I'll give absolute credit, was one of my mentors in this process. I worked in an office. A guy rented space from the office I used to work in named Luis Garcia, who is he's a Colombian physician. Although he grew up in the United States, he practiced in Colombia, and he got tuned into and he used to kind of do a lot of the same stuff that I was doing with the neural therapy, the IVs, the homeopathics, what I would ozone therapy, the vitamin drips, what I would call kind of full scale like functional medicine. Full scale, not the whole thing, the IVs, the supplements.
Yeah, I've done it. I've done it all, stuff. As you know.
Yeah, you know. So, and he left all of that because of the results that he was getting with biomagnetism.
Mm-hmm. Okay, cool. So get into this. So
yeah,
this
is, yeah, I would help and fix a lot of people with Lyme, but like I would get patients sometimes where despite and at this point I was starting to use AIET more and more and more to like figure out people's
mental. Can you tell people what that is?
Yeah, it's called advanced intuitive energy testing. And it's kind of a combination of using direct intuition and also using some kind of with some osteopathic techniques on my own body to figure out like what's going on in somebody's system without using any kind of laboratory or imaging techniques. And the reason I do this is because of these very limitations that you're describing. So, any test, whether it's AIET or an MRI or whatever, they have benefits and limitations. So the benefit of the AIET is I can detect stuff that the standard testing is not going to figure out. It allows me to synthesize things that those tests won't necessarily synthesize. The downside of it is that unfortunately I can't reproduce it and prove it unless we're going to like tissue biopsy everybody, and but that's completely impractical.
So at this point, anybody who's listening to this, there's got to be some people that are like going, "What, really?" Right?
Yes.
So what made you think to go that route and think that that's a viable option?
Simply because people in front of me weren't getting better with what I learned on my functional medicine and ozone course. So even after all this, right, like chelation therapy, ozone therapy, functional medicine, regenerative medicine, you name it, like I did the course. And even still, I had people in front of me that would still not get better despite me having done everything that seemed appropriate. Mm-hmm. And so the more of this that I got, like I knew I kind of had these talents of AIET since I was a kid, but I never thought that like, oh yeah, this is what I'm going to do in medicine. I'm going to bring this stuff in. No, I thought I was going to order some blood work and some imaging, and it was going to tell me exactly what was wrong with somebody. And then I should be able to make a rational plan based on that data that I have ascertained from that testing. And the person in front of me should get better. Right?
Yep.
Maybe not.
Right.
So the more of that I would call it pain of the person, because I take it super seriously. If somebody's in front of me and they're not getting better, like I feel it and I dig and I dig and I dig and I dig until I figure it out.
Yeah. So talk about intuition. That's a really interesting term, right? Because when we think of intuition, we think of, or at least I think of, a feeling without data, basically, right? It's like, I feel a certain way about this thing. I don't know why, but we have that term because a lot of times it's right? The reason we
Correct.
have the term intuition is because it's correct quite often.
It often can be correct. That's right.
And so where does that come from? And also, how do you get trained in this? Like AIET? Like how does one become an AIET practitioner?
I figured it out on my own.
Okay.
I mean, one day I am going to start training other people to do it because I am able to fix a lot of stuff that other people can't fix now. So I think it's by that alone, it's probably worthwhile training other people how to do it. So it's a great question. Let me see what order to answer it in. So let me talk about the forms of intuition first, and then I'll describe the anatomy and physiology of how intuition works. So there are many forms and subforms of intuition, but just for people that are new to this, to give a scaffold based on the everyday experience that most of us, or maybe not all of us, but most of us are having, we have 5 senses, right? Sight, smell, taste, vision, all that stuff. And so we exist on different levels. So I would say we all have, there's different ways to organize this, but for simplicity's sake, I would say that every human being has 3 levels to them. There's a physical level, which we all know is comprised of skin, nerves, arteries, veins, lymphatics, bones, and organs, right? All that stuff. And then we have a subtle level. So the subtle level is, it's more of an electromagnetic. Well, it's not exactly electromagnetic. It's subtler than the electromagnetic. But this is the part of the anatomy that comprises the meridians that the traditional Chinese medicine doctors and the Ayurvedic doctors talk about. The energy vortices that the more New Agey crowds will call chakras. These kinds of things. So that's another part of our anatomy. And then
energy body, basically.
Sure, you can call it energy body. Yeah, there are many different.
Yeah, and look.
Yes.
I'm a huge believer in that, right? From what I've seen on my own, like through acupuncture, which I've found super effective, qigong, breath work, like all of that stuff is so effective, at least for me.
Yes,
that it's a place you need to devote attention.
100%. I recommend some form of energy hygiene regimen to most of my clients. And
I like that term, energy hygiene. That's good. Yep.
It's a lot. It takes a little bit more for someone living in New York City than someone living in Montana, for sure.
Oh yeah. No, I talked to, when I had Casper Schultz on from New York Center for Innovative Medicine. I mean, he lives in Manhattan, and I was like, dude, how do you live? Because when I go to the city now, I feel it. If I'm in a high rise in Times Square hotel for a couple of days, I'm like, I got to get out of here. It's like, it's just so much dirty energy there. That's just
on so many levels.
Yeah. Bombarding your body. I mean, to me, it's like when I talk to people and I'm like, where I mention, we turn our Wi-Fi off at night, and they're like, why? I'm like, cause that's energy that's hitting your body like at all times. And if you're sleeping with that, like your nervous system is sensing that shit, And so it's like, just the fewer signals are hitting you at any given time, the better off you are, the more you can sort of return to
100%. And not uncommonly, I would see this when I used to work in New York, and I still see it with my clients who live in the New York metropolitan area. People with chronic Lyme, like they'll leave New York City and some 30, 40, 50% of their symptoms will go away. They'll come back to New York City, they come back. They leave New York City, they go away again. They come back to New York City, they come back again. I think a lot of it is the EMFs. I think people get super EMF sensitive. That's part of it. But let's not get too far away from the initial question.
We're getting distracted here. We got it. So energy, body, and then number 3.
And then so number 3 is what we can call the spiritual or the causal body. So this story is so for me, this is a fact. Hopefully I'm not rocking too many belief systems out there. If you choose not to believe it, that's cool. I'm not here to proselytize or change people's belief systems. My experience and my perception is that the human soul, if you want to call it that, reincarnation happens basically. We've lived many lives. This is our meat suit for this particular lifetime. And when we're done with it, like a pair of old clothes, we'll discard it and we'll move on to another one.
This is where I'm like, okay, like, I mean, this is where it gets like, it's pushing the boundaries for me.
Totally.
Right. Yep. And so, and I think that's important to say, right? Like you and I have worked together. We've done this kind of remote energy work. and I have found it helpful. Sometimes I got to the point in my own recovery journey where I started going, you know what? If something helps, I don't really care. I don't have to believe it necessarily, right? And
Yeah, and
and
that's kind of what I ask of my clients when they come in. I don't necessarily need people coming in as fervent believers, but I need
right.
somebody's mind opened enough that they're not going to block a good effect from coming to them. But that's you're hitting the nail on the head. It's kind of hard to argue with success.
Right, right. And so, I used to I've said it before to people, friends of mine. I'm like, look, if somebody came to my house and like waved chicken bones over my head and that fixed me, I'd be like, okay, fine. Because for the
Yep.
longest time, I'm somebody who likes to know. I like to understand things. I'm a very sort of pragmatic, linear. I shouldn't say I'm only a linear thinker. I think abstractly as well, but I like to understand how things work. And I think for a while that was a little bit of a hindrance for me where I had to be like, wait, that really has to make sense to me. And then I think you get to the point if once you've tried enough things where you go, okay, let's give it a go. Like, do enough
Yeah.
research where you're like, is this dangerous? No, I don't see how it's dangerous. Sure, let's try it. Why not?
Give it a whirl. Yeah.
And give it a whirl and be like, okay, yeah, I'm gonna push the I believe button here and
Yep.
see what happens.
Yep.
So go ahead.
Any kind of a healing intervention that you use, whether it's IVs, homeopathic, supplements, waving chicken bones, prayer, energy medicine, whatever it is,
Right.
The idea is it's going to have some sort of an effect on either your physical, your subtle, or your spiritual or causal body, or some combination of all of those. So what we're looking to do with the AIET, the way I've developed it, is you're looking to get the most you can out of it in the order that's going to work the best for the person in front of you.
Yep.
That's what we're looking to do. And so intuition.
Sorry. So is your practice mainly working there in the sort of causal spiritual body?
No, it really depends entirely on what the person shows up. Like I don't like, a lot of practitioners work this way where they kind of have they work this way in that they have a tool, and whoever shows up in their office, that tool gets applied to that person and you kind of see what you get. The way it works in my practice is the person comes in with whatever they are. I use my intuition to meet them where they are and use the tools. And I got a lot of tools I can use, but I use the tools in my toolbox to create the shifts on the level of of physical, subtle, and causal, so that they can get to their goal. Mm-hmm. So what I did with you, like you see, like I tell you, I'm like I don't know what we're doing today. I never
right.
know. Yeah, it all depends on kind of on what happens in the conversation between me and your system, and then we flush it out, and you keep peeling back the layers of those onions. So back to your question about intuition. So in the physical sense, we can see, touch, smell, taste, all these kinds of things. So in our subtle bodies, in our subtle brains that interface with our physical brain. So interestingly, the physical brain is actually more of a restrictor plate. Because you'll see, because like when people have out of body experiences or near death experiences, their perceptual capacities are usually much more expanded than they are when they're in their physical bodies. But then sometimes they get an opening in the physical. Sometimes their subtle bodies and their physical bodies will kind of link up, and they'll get an upgrade there. But it kind of demonstrates the point. So certain people, and there's a couple ways to do it. Will have what are called brain center openings. So in their subtle brains, not their physical brains, but their subtle brains, the Hindus and the Buddhists call it the 1,000-petal lotus. It's kind of metaphorical, but the point is there's many energy centers in the brain, and these, when turned on, they kind of give you like access to like a superpower, so to speak. And there are many types of brain center openings and so-called superpowers that you can have access to. And for some people, I would say that probably all, to some degree, all the people that you were on the SEAL teams with had certain brain center openings for physical prowess, right? Because it's not everybody that can make that, right? That's a very small percentage of the population that's able to do that. There are brain centers for musical ability. There are brain centers for mathematics. There are brain centers for subtle perception and intuition on the level of sight, touch, hearing, seeing, taste, whatever. And for athletic performance and so on and so forth. So generally anybody at the top of their field in anything, they're going to have brain center openings. There's a reason, because we all have kind of similar hardware, right? But their software is a little bit different. There's something that allows people to operate at that higher level, and so this is kind of the anatomic explanation of how that works. So there are certain brain centers that people have that when opened up will give them access to more precise forms of intuition. Everybody experiences a gut feeling of intuition, right? Like if somebody's trying to take advantage of you and your solar plexus is kind of tingling and kind of getting tight, and something in your gut's telling you maybe you want to run and not walk to the nearest exit. So everybody's got access to that, but other people have access to visionary experiences, auditory experiences, gustatory experiences, so on and so forth, that are really more on the subtle plane rather than the physical plane. Now, the challenging thing with this is that the psychological and psychiatric field has largely pathologized anybody who has access to these things, because they think that anybody that sees anything must be crazy, right? But like anything else, nature loves a bell curve. So there are people like that will use these abilities, and they'll be in a professional setting and functioning at a high degree and changing people's lives for the better. Dentists, doctors, lawyers, right, architects, these people exist. They generally don't advertise themselves because they don't want to be called a quack. And I fully understand that by talking publicly about this, I'm kind of exposing myself to that. But thankfully, it's in a day and an age now where it's not as punitive. Thank God.
Yeah.
There's more understanding for alternative and complementary medicine, even if so the medical system tends to not try to take these people's licenses from them anymore, which is nice.
Yeah.
Because and I saw it in some of my mentors. I could see the trauma in them where people had lost their licenses for treating chronic Lyme disease.
Yeah.
This used to happen.
It's there's a lot there. There's a couple different directions I want to go, but yeah, I mean, it's one of these things where you talk about kind of like the openings in your brain, and I mean, now with this sort of psychedelic explosion that's out there in terms of right? So
that's one of the ways you can get access to those brain centers temporarily is by this is what these drugs do is they give people temporary access.
Right. So this idea of and I've experienced this on psychedelics of you experience consciousness in a different way that you're not like there's a totally different way to experience the world and yourself. And once you do that, you kind of think, like, okay, so some of these things that I think I would have thought, again, are just complete bullshit. It's like, all right, maybe there's something there. And there's some physics stuff too here where, like you talk about, the term past lives is one that doesn't make me very comfortable. I kind of go, right?
Yeah.
I even think like, where are the extra lives coming from, right? Like, because there's way more people on the planet now than there were, I don't know, 100,000 years ago, right? So
we're also losing a lot of animals and insects and trees.
Okay. Anyway,
so but it's also not just this planet. It's not like a soul just stays on one planet.
Okay, right, okay. But anyway, so that's something where I go, all right, but certainly, which law of thermodynamics is it where energy can't be created?
I think it's the second. Yeah, you can't create. Yeah, exactly. So you're hitting upon the logic of like, why is it that some people are born with genius and born with a silver spoon in their mouth, and somebody else is born, and they can't, feed themselves to save their lives.
Right.
So why some child gets access to a good education, why one child gets abusive parents. This comes down to karma. Karma is kind of a loaded word because people have different ideas as to what that means. So when I use the term karma, I'm simply referring to the inevitable fruit that is flowering because of prior actions. Now many things that people experience are because of the karmas that have occurred in this life. Like one of the examples I use a lot is if someone sits around and eats nothing but Skittles all day, they're going to end up with the diabetes at some point, right? Like you don't have to go looking through somebody's past life files to figure out why that person's diabetic, right? But if somebody's like juice fasted and they're eating a plant-based diet and they're exercising all the time and they're on a bunch of good supplements and they're completely clean and they detox themselves, right? And yet they're still diabetic, it might be worth looking in their past lives to try to figure that out.
So, okay. So, and, again, this is a topic where I go, and we've done some of this, right? Like
Yeah,
we've done
totally.
this, like, what is it? The Akashic records. And, did I get that term right?
Yes, you did.
Okay. Um, but again, I go back to, like, just from a physics standpoint, that idea of energy is not destroyed. It just changes form. So,
Correct.
okay, like, all right. So the energy of a person when they die
Continues.
goes somewhere, somehow. It's just
Yep.
right. Okay. If that directly transfers into another person or however that works, I don't know. But
And I
okay,
think
like,
that's a completely healthy attitude. If you don't have the perception to see it for yourself, I honestly, I'd rather deal with somebody like that than somebody that's completely convinced that this is what's happening and yet have no experience or perception of it. So,
mhm,
like when you did those psychedelics, you can liken it to, like, imagine if you were a 2D ant walking on a line, and all of a sudden you were shown a 3D world.
right. Yeah.
So getting access to brain center openings, whether through psychedelics or, also you can get it through meditation.
Meditation. Yep. Yep.
Exactly, that's another way to do it. Some people, just by the virtue of their prior life experiences at a certain point in their life, it will just turn on,
Hmm.
because that's kind of the way they're programmed. That's another way it can happen.
So,
I know people like this. Like, they would have been like a regular Joe Schmo, and it's like some event gets triggered in their life, and all of a sudden they're talking to their dead relatives and all the, you know what I mean, like, and all that kind of stuff. It's really scary for these people. Honestly,
mhm.
it's a problem for them if they get opened up really quickly, and they have no basis of experience or mentorship. It can be a real problem.
Yep. So I think the other important point to bring up here about how we've worked together is we're not in the same location, right? So, like, this is
Yes.
remote stuff, which makes it
Yes.
even weirder, where it's like
Hmm.
you're not physically touching me. We're not even in the same room. And so, can you walk through? There's that piece, but the magnetic stuff too, with the magnets and kind of
Sure.
how that
Yeah. So,
works.
I
'Cause
mean,
that's the other.
there's a little bit of a there's kind of a quantum mechanical explanation to this to some degree. So, Einstein describes spooky um, behavior of subatomic particles. And actually, there's a mundane way that we all experience this. Even somebody that doesn't walk around with brain center openings, and they're seeing what's going on the other side, so to speak. All of us have had the experience of walking down the street, and you think of somebody you haven't thought of in months or years or whatever it is. And sure enough, 30 to 45 seconds later, that's exactly who's on the phone.
Yeah. Meaning they called you. You're not. You didn't.
Exactly.
Yes.
Exactly.
Yep. Yep. Or
Yeah. So,
texting. I had it happen to me. God, maybe a month ago, where it was the exact same thing, where I was literally thinking of a buddy of mine, and he texted me like 10 seconds later.
yeah.
And it's not
Yeah.
someone I talk to every day. Like, this is someone I don't talk
Yeah.
to for 6 months at a time. And
Exactly.
it's like, well, that's weird,
Yep.
right?
Yeah. So our subatomic particles are talking to each other. So we've got subtle connections to people that we form, and they go, and on the subtle layer. So the rules in consciousness, depending on which layer you're talking about, are a little bit different. So the rules for the physical level don't necessarily apply to the subtle. So for somebody who has brain center openings where they can perceive the subtle, then that's what enables me to do distance work. It doesn't really much from that perspective. It doesn't really much matter whether somebody's directly in front of me or if they're on the other side of the world. The results are basically the same. So once you access the subtle layer of the creation through those various brain center activations, it's not just one that does it. There are many different flavors and sub flavors of it. But once you get access to that, then it kind of obliterates the space issue.
Mm-hmm.
It doesn't really much matter. And so, and you've heard me ask you this, I'll ask you, do I have your permission to hook my energy body up to yours so that you get the
Right.
benefit?
Yeah.
Right. I know. And you kind of roll your eyes, and I'm like, I get it. Like, it's not in your usual perceptual experience. And so that's an honest response for you. And I don't really have a problem with that. And so, like I told you, I was like, just give it a whirl and see what happens. Right.
Yep.
And so what I do is I connect my energy body, my or subtler energy body, to my client's energy body temporarily. And we disconnect at the end. I tell people we practice good energy hygiene in my body, in my practice, so that I don't walk around with their stuff. They don't walk around with mine. It's just for the duration of the session so that they can get the benefit of it. And if memory serves, the pattern's kind of been this way, is that, usually when we do this kind of a treatment, you usually don't feel much as it's going on, but then maybe a couple hours or a day later, it's like your world gets rocked, and then it becomes undeniable that shifts are happening. but it's not so clear in the middle of the session. I have other clients that will have a lot of these brain center openings, and to them, it's like they know their world's getting rocked as it's going on. It's very obvious to them, and sometimes they're almost taken aback because it's a lot that's getting shifted in an hour to an hour and a half, however long the session is. I really want people to move. I don't want my time wasted, so I don't want to waste anyone else's time.
And so, describe the magnet piece of that too. That you do.
Yeah, so I learned the scaffold of this from Luis Garcia, but I kind of took the principles of it and made it my own. But the basic principles of it is that, back to 3D physics before we get into the distance stuff. The body is 60 to 70% water, and it's a known fact of physics that you can change the pH of water with a magnet. Pretty straightforward. So the cool thing about the magnets is, you use neodymium magnets. Let me grab a couple and just show them on the screen so people understand what they look like. This is what they look like. I have three sizes. I have a small ones. I have medium ones, and I have. This is going to take a little bit because they're kind of strong. Come on. Oh, there we go. Okay. Yeah, these are pretty strong. And then there's the large ones. So just depending on how big the target is really where it goes. So like if I need to treat an eyeball, I'm probably not going to use the big one.
Yeah. Okay.
Yeah. So when you put these magnets on the body, it shifts around pH, electrochemical gradients, and it also shifts around the subtle energy that moves in the body. And so when I hook my subtle body up to my clients, it enables them to get all the benefits of what those magnets are doing as if they were put on them. It's so convenient. I love it. And actually it's a little bit energetically cleaner to have somebody at a distance than right in front of you. So it's nice. So, you would see, right? We would do, the first couple sessions, we would do it and, you would have very obvious Herxy die off kind of reactions. From my memory, but then your symptoms would improve pretty rapidly. So the first, 3 or 4 sessions we did from memory, a lot of it was very physical focused. We weren't really doing much of anything in terms of subtle dynamics.
Yeah, that's right.
Of past,
that's right.
Yeah. It was more of kind of physical cleanup. And this is actually a pretty common pattern that I see with people that either have COVID or chronic Lyme, where a lot of the physical stuff will get cleaned up. And then there will be 3, 4, or 5 symptoms that are kind of the clinchers, so to speak. And these are the things that have more mental, emotional, and spiritual baggage behind them. And they take a lot more skill, time, and energy to work out. It's a pretty common pattern.
Yeah. And it's just so everyone kind of understands, like you and I will be, again, on a Zoom call. I'll be lying in my bed, you're lying on your table in your office or whatever, and you've got like, you're sort of going through this, and by the end of it, you've got like 50 magnets all over you.
More,
and you're taping them to your head and like all this stuff, right? Again, wild stuff. Getting back to sort of the I don't know what you want to call it, but like the physics approach to this, the thing that when you were on Freddie's podcast talking about this, the thing that sort of sold it for me was, at least in principle, was the idea of quantum entanglement. The idea that, like, in quantum mechanics, atoms that could be separated by as far as, light years.
Infinity.
Right?
Yeah.
Infinity, essentially.
Yeah. They're still communicating.
They are communicating with one another. So they are entangled. And like, if you spin one way, the other one responds immediately, right? Like, and that's the thing. It even moves faster than the speed of light. It's like instantaneous, which is a real thing. As far as I know, that's what physicists say. And so it's like, okay, well, if that can happen, then sure. And the other thing is, like, we carry around these damn things that are transmitting energy all the time, right? Like we're transmitting, like we were talking about at the beginning of this podcast here, like, Wi-Fi signals and cell signals, and that's all energy. And we're totally accepted of, like, that can beam all over the place and instantaneous energy.
We're all transmitting all the time, whether we want to or not.
Yep.
Okay.
So what else about what you do do you want to share with people? And like, what are some, maybe some big results you've gotten with people, or like, folks that you've been able to cure that had had no hope type of thing? I mean, I'm sure you've got some stuff like
Yeah,
that.
I've had I don't want to give personal details away, but
Right,
it's
of course.
it might be more beneficial to talk and talk about kind of what you experienced from that standpoint. But yeah, I get a lot of people that have kind of like that are at their end of their rope. I mean, honestly, it's easier for me to get people that aren't at their end of the rope.
Sure.
It's just easier. And look, I can't fix everyone. I'll be straight up. I had a couple of people from Freddie's podcast that I had to let them go because I just wasn't able to move the needle for them. And part of my lesson there at that point was that there are some people that have such entrenched emotional, mental, or spiritual issues that it just like they need time in order to be able to fix it. So that's kind of been one of my lessons, is to identify these people more quickly and send them on their way. Which has been tough because I don't ever want to tell someone no.
Sure.
Like I get it. Like if someone's coming to me, generally, like they're in trouble.
Yep.
Or they're really open-minded. It's usually one of the two. They're either in trouble or really open-minded, or both. Because I get it. I know very well how all this sounds.
Yes. Yeah.
I get it. Yeah. And I guess what I keep coming back to is that, I mean, the results kind of speak for themselves.
Yeah, sure.
You can't really contrive that. I mean, do you want to talk a little bit about what your evolution was?
Sure. I mean, we can. I mean, it's, I think like everything I've done, it's a slow process, and I continue to sort of stair step it up. Like I've had a couple of bad days recently. I will say, we're talking at the beginning here, I've really figured out with myself that like the least amount of supplements I can take is the best thing for me. Like just anything I put in my body, if I overdo it, it just jerks the wheel too hard for me. So it's like,
I'm with you.
Yeah, it's a gentle nudging thing. And I think it's a lesson that was so important for me to learn. And I still learn it. I still have to learn it sometimes, that coming from like the profession I did, and anybody who's a veteran or whatever, we like this, like everything is just go hard, like kick your own ass. And I still operate that way when I work out and things like that. But man, everything else is the opposite for me. And the more I make it the opposite. So it's like when I go into the gym, yes, go hard, work out. That's effective. I like it. It works. But meditating, breath work, supplements, any of this stuff, it's like the solution is not dumping 1,000 supplements into your mouth all at once because you're like, more is better. It's like just a little bit, like just gentle nudges. And it's hard because it takes long.
Yeah. It also, your circumstances are a little bit unique in this, in that, well, and this is a good kind of segue into discuss how we got from just doing magnets and really focusing on your physical stuff. Cause it was like, you had circulation issues, you had some aches and pain issues, you had some neurological issues, aside from the head stuff, that stuff got sorted out really quick within a few symptoms. It was like not everything, but almost everything from your neck down fixed within the first 3 or 4 sessions. That went really quick. And so that stuff largely had more of that was more of a physical level issue. And then that trifecta of the brain fog, the fatigue, and the head pressure. And I think I even said it from the beginning. I was like, this is probably going to be the hardest thing we're going to work through. And it's going to take time to chip away. And so the operating principle here is that toxins and infections get stuck in parts of people's bodies that resonate with unprocessed mental, emotional, and spiritual baggage. So if somebody's got a big boulder of past life garbage that's sitting in their system that correlates with a particular part of the anatomy, these are the people where you do all what seemingly is the correct physical interventions, IVs, supplements, medicines, whatever, and either they don't get better or they even spin their wheels and their symptoms. These are people who are setups for die-off reactions.
Yeah.
Right. You got a whole bunch of mental, emotional, spiritual stuff behind that's kind of anchoring an infection that's creating certain symptoms. You try to get rid of that from the physical sense before you've done the subtle work. Forget it.
Yep. And what's interesting about that is it's like a double whammy, right? Because I talk a lot about how trauma, like an experience, right? Traumatic experience can get stored in your body. So like this, like sort of negative energy, right? And it can be anywhere. It could be in your arm. It could be in your liver. It could be, and then you have that like dysfunction that's going on there. But then on top of it, like you're saying, is if you then have a toxic overload in the form of heavy metals or parasites or whatever, that then ends up in those same spots, right? And so it's like that much worse. So it's like all this junk.
Yeah, the world's kind of a dangerous place to live in now.
Yeah. Oh, yeah. Oh, for sure. Yeah. I mean, the trick
from that standpoint,
yeah. The trick is not to get freaked out by it, because that doesn't help you either.
Right. So it becomes the game kind of becomes picking and choosing the interventions that you're going to do on the physical, the subtle, and the spiritual that are going to most move the needle for you right now. Yep. And because so much of your process has been about undoing the spiritual baggage after we hit that inflection point of the first 3 or 4 or 5 sessions or whatever it was. And you saw like we got you off of a lot of your supplements, because it's like in this kind of a thing, if you try to push it too hard, like this is exactly who's going to have a die-off reaction, and then they're going to get frustrated, and then they're going to potentially lose faith in something that otherwise would have worked for them. Yep. So most of the people in this position where they have a lot of spiritual baggage in it. Anyway, I try to limit people's supplements anyway, because I get a lot of people that have been on 50 supplements at a time.
Oh yeah.
I can't stand it. I've been there.
Yep. Were you ever a chronic illness patient? You were. Okay.
I had to fix myself.
And what was going on?
Lyme.
Okay. Yeah. It's usually just
associated infections.
Right. I mean, that's the other thing is like, again, that this sort of soul, like Lyme, just that is, in my experience, it's just one of many things that's
going on. And when I say Lyme, I really mean a Lyme complex. And it was interesting for me. It all came out after a surgery. So I really got to see firsthand how much anesthetics can suppress people's immune systems.
Oh yeah. Yep. Okay. Yeah. And probably the trauma of the surgery too probably had something to do with it. Yep.
Yeah.
So how long did that take you to fix?
Years.
Oh gosh. Yeah. Well, I mean, I shouldn't say that. I'm the same thing.
I still have whispers of some of it.
Sure.
But I'm also aware of like a lot of that was like kind of wrapped up in I talked about my 10 years of hell with Freddie, the deep spiritual cleanse. So a lot of that, those tick-borne infections have resonance with that. So knowing that, I'm not really in a rush to get rid of it, because I've actually done it before. Or I've done I did like an ozone IV, and I had a bunch of Bartonella, got riled up from that, and I got so angry, and my wife was like, I cannot deal with you. And I was like, and after I came out of that fog, I was like,
yeah.
I couldn't deal with that either. So I learned the hard way. Like you can't push it too hard. In a chronic illness state, I think it's a very common mistake that people are trying to find the Occam's razor. They're looking for that one magical pill that's going to. And it usually doesn't work. I mean, Every once in a while you see that, and sometimes I get those kind of results in my practice, but I don't lean on having to have them, because for most people it's not really realistic. For most people that get into this chronic illness state, whether it's Lyme, chronic fatigue, fibromyalgia, whatever it is, the more mystery things like you described. It's a process of peeling layers off the onion. And certainly you want to apply the appropriate physical, subtle, spiritual interventions where appropriate. But if you push it too hard, it's going to become a problem.
Can I ask when you're doing this practice, like you're with me and you're sort of doing the thing on your arm, what is it? Can you describe what you sense? Is it like you see things? Do you?
Yeah. So you can. I get kind of visual impressions of things that are going on, and then a lot of what I'm doing with my arm. So in the osteopathic profession, there's this whole branch of it called cranial osteopathy. And the idea is that there's this motion that's going on in the body all the time. And actually there have been MRIs that have demonstrated this, that the cranial bones have a motion on the order of
and I've done some cranial sacral stuff.
Yep. So what I'm doing is when I'm sitting, you often see me sitting like this, like in the session, right? And so I'm I'm exaggerating. It doesn't actually look like this, but I'm exaggerating this so people kind of get the idea of what it can feel like. Is that there's an internal and an external rotation going on in paired structures in the body. So so arms or legs, right? Your shoulders, right? There's this internal, external rotation. In any midline structure, you're getting something called flexion and extension, right? So this is going on autopilot in everybody's body. And so this is more of a confirmatory thing for things. It's a little bit of a dance, the way AIET works. And so it's not just pure intuition. A lot of it is using, my understanding of anatomy and physiology and experience and kind of blending it with the intuition. Because you'll see me sometimes say something like I'm seeing something within, and I'm like, this doesn't make sense. And then I have to backtrack it and kind of work with it and figure it out. So you can get visual or auditory data, but I'm doing that by talking, with the intelligence in your body to kind of figure out what order are we going to do things in today. But it's like at each step, there can be any number of refinements that get made with that. And a lot of when I'm listening to this rhythm in my own body, it's kind of like a barometer for how on track I am. Mm-hmm. That's largely, you can use it for other things too, but that's largely what I'm using it kind of as a confirmatory test. And it's funny because I know like one of my colleagues who, not an osteopath, but kind of does healing work. This guy's got very fabulous brain center openings, and his access to visual and auditory subtle information is quite spectacular. And he would still muscle test. And I would be like, dude, why do you do that? I don't think you need this. And now, years later, I was like, oh yeah, I see why he does this. Cause you need to confirm things. So it's a matter of connecting with the intelligence on a subtle level in somebody's system and figuring out in what order and what dosage and how much to do and how far can I push on the specific layers of somebody's system so that we can get the most forward improvement today. And you're kind of to this point where I would say you're kind of at critical mass. Like you're not symptom free yet, but you're getting days of symptom freedom. And this is kind of around the time that we had anticipated this would happen, that you would start kind of getting this. So you're starting to get those days now. And so you've kind of hit the floodgates. And so I'm not surprised that you found some gut thing that like completely changed things for you and is giving you spectacular results.
Yeah.
When people clear this subtle crap, it's like the right things will just flow to them effortlessly. Mm-hmm. The effort was in clearing the garbage, right? But once that happens, it's like things tend to come easier. Things tend to work more seamlessly. It goes like this.
Yeah. Yeah. And what I really notice about it is, anyway, we're talking about this just kind of gut healing stuff, the smoothie basically that I'm doing. This is Josh Mason's Detox Dudes protocol stuff. And it's really helped kind of get rid of like anxiety, like mini panic attacks and things like that I would still get. It's interesting to me how much your gut, even for someone who doesn't think of like, I don't have gut problems, I'm not bloated but it's like, oh wow, like that really does make a difference.
I'm doing the AIET thing now as you're talking about it, and what's coming through is it really is, and it's doing more than just sealing up leaky brain. It's also fixing like other neurotransmitter issues that have been going on as well. So this thing's I'm not aware of that. I got to look this thing up now. Josh Mason.
Yeah, Macin. He's
okay.
Josh Mason, Detox Dudes. He's got this whole detox protocol where it's like he was somebody who was super, super sick as like, I think he was in his 20s and he was a Brazilian jiu-jitsu champion and just got like super sick. His story is so similar to mine. It's kind of like almost listening to an autobiography, tried all this stuff. And then he finally got really hardcore into detoxing his body through all these various protocols and liver detox and colon detox and heavy metal detox and, parasite, blah, blah, blah.
He wasn't signed up for as deep as a cleanse as you are. Yeah. Because you'll see once, because now that you've got like a critical mass of the spiritual stuff gone, it's like now all this other stuff like the sauna, like all like the detox supplements, like all this stuff will start like working.
Yeah. Yeah.
And
But again,
this
but I really do find that I can overdo it. I can like take too
yes,
many, and it's like it's just too much. And so
yes,
I've just learned that my body over time is something that it's like just gentle nudges, like introduce something a little bit, get used to it, and then kind of try something
yes.
else. You know?
And
Yeah.
you can overdo it on the physical, the subtle, or the spiritual.
Sure. Yeah. 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 Yeah.
Yeah, you do. And I had the great pleasure of being overtreated by colleagues a couple of times. So like,
Yeah.
I
Yeah.
understand. Yeah, and you'll see me stop sometimes very abruptly in a session and be like, all right, you're done,
Mm-hmm. Yeah.
with like a very clear finality, like for today, like that's it, no more.
So I guess just to kind of wrap some of this stuff up, I guess anything else, or like what else would you say to people out there that, you know, again, I think it's really important to sort of highlight that, like for me, I don't have to necessarily buy into absolutely everything that you do, right? Like, or that
Sure.
the way you think, um,
Yeah.
to sort of be like, hey, you know what? Let's try this and let's see what this can do. Especially when you hear of other people like, yeah, it was really helpful, you know, type of thing. Like, okay, cool, let's give it a try.
Yeah.
So, I guess what would you say to? Because there's certainly people out there that are like all into it, and they're all about spirituality and the soul and,
Mm-hmm.
you know, psychics and whatever else. And then there's
Yep.
other people more like me who are like, you know, that's all bullshit. So I guess what would you say to those folks who might be thinking that, or people that might be struggling that have yet to find an answer, right? That are kind of still
I
searching.
think you actually really started hitting on this earlier when you were talking about learning your lessons with things. Like, so you were realizing, don't push it too hard, just enough. And so the thing is, and this was kind of, this is getting a little bit out there, but I feel compelled to share it. Like one of the kind of more otherworldly experiences I had was I was like sleeping over at my parents' house, like between like on a break or something. And I remember being in bed and I lifted up out of my body just spontaneously and went to the other side. And I kind of saw how it worked. I know it sounds crazy, right? But this is what happened. And I've never done hallucinogens, so I wasn't flashing back, but I have done a lot of meditation. So that can kind of set you up for that kind of stuff. And I kind of saw how things worked and how like decisions would get made, that people would have certain lessons and things to be learned, and how like things were kind of set up, how the mission was kind of set up before they came in. So that's kind of the spiritual explanation of it. But I mean, everybody can, whether they buy that or not, everybody can buy that. Like, if you pay attention, your life is trying to teach you some lessons.
Yeah.
And for some people, these, like the guy Mason that you're talking about, from what you're describing, I'm not reading him because I don't have his permission, but from what you're describing, it sounds like for this guy, a lot of his lessons are on the physical level. And he got a lot of these really great results by applying these kind of physical interventions. And so his life force energy increases and expands as he gets aligned with learning his lessons. His lessons are not necessarily your lessons. Your lessons are not necessarily someone else's lessons.
Yeah.
So with this whole chronic illness thing, for some people, it's, the lesson may be as simple as, it's time to move beyond the allopathic paradigm.
Mm-hmm. Yep.
It may be that simple. And these are the kind of people where it's like, you put them on a little bit of, Byron White's product or knotweed or whatever, anti-Lyme herbal, whatever. And then they walk out of your office river dancing because that was their lesson, is they had to overcome that prejudice and that thinking that only this box is what's going to work. And then there are other people where they may have deeper rooted mental, emotional type of issues that get trapped in their body. And so when those things get trapped in their body, it's a setup for not just Lyme, but, Rocky Mountain spotted fever,
Yeah.
Babesia, Bartonella, other things too, Epstein-Barr virus, whatever, right? It becomes a setup for those things getting stuck. And if they don't release the energy of what they had taken on and stored, these are the people where it's like, these things keep coming back. And I've seen some people do some really rad stuff, fat, autologous fat stem cell transplants. I've seen people go to Europe and do whole body hyperthermia and
Yeah, right.
blow their temperature up to 105 or 106 or some
Yep.
crazy number.
Yep.
And I've seen these people be asymptomatic for a month or 2 or 3, and then it comes back.
Mm-hmm.
So so somebody with the chronic illness state, depending on the levels of causation for them, their lessons will be there. And for each individual, it's a little different, right? So your stuff, you had a little bit of everything. So you've really, I mean, you signed up for quite the quite the ride,
But the bonus
right?
plan,
Yeah,
awesome.
man, yeah. You're like on the
package.
Platinum Express, seriously. But you would see, right? We would do these spiritual type of treatments, not do any magnets, not do any herbs, right? And you would have die-offs, and then you would see that things would improve over time. But often, it's like you experience, and I think this is good for people to know that the healing journey for chronic illness is almost never a straight line.
Nope.
And this is why I tell people, like when I start working with them, I tell them it's usually going to take a year for me to get you fixed, so to speak. If it's Lyme, there, other things can be a little bit different, but people will go up and down, and there are often some more core issues that people will hit their heads on. And for you, it's the brain fog, the fatigue, the dizziness, and the head pressure. And when people hit that core stuff and those symptoms get flared up, and you've seen it, right? The mental, emotional baggage flares, and the common experience is, oh my God, it's never going to end. It's always going to be like this. Nothing's ever going to help.
Yep. Yeah.
I've hit this wall many times.
Yep. Oh, I have too.
Yeah.
I have too.
Yeah. So it's common that wall is there, but I think it's helpful for people to understand that that's an expected part of the process. It's not a comfortable part of the process. And if I had it my way and my name was God and I had a white beard sitting up in the heavens, I guess maybe I wouldn't organize it that way. Or maybe if I was in his position, I would. Who the heck knows? But that seems to be the way that it goes, is people will hit upon those core things. And you've seen that as every time you hit it, it gives us an opportunity to dissect it a little bit more. And each time we dissect it, the overall symptomatology falls off of you a little bit more.
Yeah. And I think, one of the primary lessons I would say that I've learned through my experience is that you have to know yourself better. And most people don't know themselves. They really don't. They don't pay attention to themselves. They don't pay attention to what's going on inside their minds, inside their bodies, really. And the more I've really tried to pay attention and understand myself, the more I've been able to sort of make headway, make progress.
So for our listeners, this is a star student.
Thank you.
Yes, this is a star student. This is excellent. I wish everybody would be thinking this way. But old habits can die hard. But the more people can get their mindset where you're at, the better, because you're really hitting the nail on the head. You're being congruent with your lessons. And as long as you keep being congruent with your lessons, and unless you're one of these people where it's, certain people have such hard spiritual issues that nothing can be done for them. And it breaks my heart when I see it. But being in this kind of a practice, it's part of it. You're going to run into these people from time to time. But when I get new clients and they've already done some interventions and they've already had some improvements, I breathe a sigh of relief, because I'm like, oh, good. You're not so stuck that nothing can't, I'm like, great. So I think that's kind of what we talked about at the beginning. I was like, yeah, it's going to be a journey. It's going to take some work, but it's you went to NYCIM, you had a whole bunch of improvement.
Yep. And again, even that was probably, I told Casper, I probably got about 25. I don't know. It's hard to put a number on it, right? But call it. I went in there probably at 50% improved, and I came out at 75. And I still have times where it nosedives on me. That's the other thing where. Yeah. But again, I'm really figuring out that it's when I try to do too much, when I try to push the accelerator, and that's again not an exercise thing. It's when I try to over treat myself.
Yes.
That's where it gets fucked up.
It's a fairly common lesson, but it's a very challenging one to learn,
It
especially for
is.
somebody who really is a responsibility taker in their life, as you very much are, because then you want to move the needle,
Yep.
but then you have to learn to have the skill to move it in a way that it's not going to backfire and bite you in the ass.
Yep. Yep. All right. Well, this is great, man, and I've enjoyed. We're still working together a little bit. I don't know for how much longer, but I think we have an appointment next week after Christmas. So
I think we're getting to the point where maybe you'll touch base here and there, but I mean the bulk of it has just about gotten done for you. So you're getting those asymptomatic days, and as long as you continue to learn your lessons and live your life in congruence with that, eventually the days will come where you're more asymptomatic than not, and eventually this will be a memory.
Yeah, it's good to hear. All right. Well, so if people are kind of interested in what you do, want to find out more about you, get in contact, where do they find you?
Yeah, I got a website. It's www.systematic.healing.com. SYSTEMATICHEALING.com.
Good. Nice.
Yeah, that's the name of the practice.
Do you do social media at all, or is it no?
I do have an Instagram and a Facebook page, but I don't really manage it or do much with it. So it exists, but I'm kind of, personally, I'm still very much in kind of like deep retreat mode. So I'm not like, I anticipate in the next 8 months to a year, I'm going to end up being a little bit more out there. So, when people ask me to do things like a podcast, I don't turn them down, but I'm not necessarily actively seeking to put myself out there right now.
Got it. Well, I appreciate you coming on here because,
man,
like I said, I will just close again with, for anybody out there, you don't have to buy into all this stuff. There's pieces of it that I still kind of go, really? Like, but I think, again, one of the key components I've found for my own sort of journey is like, don't be afraid. Again, don't do things that are dangerous. Like there's things out there, there's treatments where it's like, I'm not doing that. That's like some dangerous stuff. But, and everyone's got to make their own judgment here, obviously. But I remember Ben Aarons, who is founded Reorigin. When he went to NYCIM, he said that he essentially just kind of sized things up and was eventually like, I got to take a leap of faith here. And that's what he did. He was just like, got to the point where it was like, okay, I feel good enough about this where it's like, go in on it. And so that's kind of the same path I've tried to tread with things. It's like, okay, somebody I trust is like, yeah, I found this helpful. Check it out. Is this gonna hurt me in somehow? No, I don't think so. Like, all right, let's give it a go. See what it can do. So, but again, to each his own, right? Like, I'm not a doctor here, and I'm not.
Yeah. It's incumbent for every especially people that are going through the chronic illness process, listen to your gut, because I'm not right for everybody. Everybody's not right for me. And the same holds true of every other practitioner on the face of the earth. And same thing for treatments. Sometimes you figure this thing out for your gut. I got other patients or clients that they've figured out key pieces of supplements that wasn't necessarily on my radar. Great. Yep. I don't figure everything out, but my job is to get people unlocked.
And that goes back to that just goes back to that know yourself thing. That like the Oracle of Delphi had it right. Know thyself.
Know thyself.
That is like, you have to figure it out for yourself. And it's just like, it's not the same for everybody. Like you said, there's some people that like will make great strides with someone like you. Others will not. And doesn't mean it didn't work for the people that saw improvement there. It's just that we're all different, like in these various ways. It's just, we're not the same. So, cool. Kevin, thanks, man. Really appreciate it. And I'll see you again in a week.
Sounds good, man.
All right, man.